I'm Marie McLaughlin, and I have the honor of being the current president of BIAPA. And I just wanted to spend a few minutes sending out a message of encouragement and support as we all go through coping with the COVID situation. Certainly, we know that on top of everything else you're dealing with, this certainly can prevent a hardship. And interestingly, there's two ideas actually that I think are very important that I wanted to emphasize. It goes without saying that everything important I have learned about brain injury, rehab, and surviving over the years, I've learned from my brain injury patients as well as their families and caregivers. When I worked in an acute rehab hospital and certainly in the post-acute setting of ReMed where I work now, there are two really important ideas in the rehab process that I think apply to us all right now. The first idea I want to mention is that we know about the importance of structure and routine. Certainly that applies to us all as our routine has been blown to bits in the COVID situation. And it doesn't have to be anything fancy. I mean, they talk about block scheduling, which essentially means just take big chunks of time and say, well, this is what I'll dedicate to this task, etc. But within that idea of the importance of structure and routine, it's simple things like having a set bedtime and time to get up, making sure you eat 3 meals a day, scheduling some time for exercise or watching a Zoom video. Certainly scheduling some time to be in contact with friends and family members on a regular, really daily basis. It's important for us to connect. Over time, researchers, just common sense, has told us that having a structured schedule will give us all a little bit of a sense of control when we're in a presumably out of control situation like handling the COVID virus. So it's very important for us all to take that important idea from brain injury rehab and apply it to our daily lives now, the importance of a structured schedule, a routine. The second idea, I mentioned there were two ideas that I come back to that I've learned a lot from my patients over the years, is the importance of acceptance. I just want to mention that one of the definitions of stress that I have always liked over time is this idea that stress is the difference between expectation and reality. So, if you expect to be able to travel somewhere in 30 minutes to get to an appointment and you run into a bunch of traffic and it takes you 60 minutes, then you've got an additional 30 minutes of stress. Same thing now. If our expectation was that we'd be with family members for Passover and Easter, or we'll visit family for various events, birthdays, Mother's Day, whatever, and we're unable to do that and are pretty isolated instead, that certainly gives us a big difference between our expectation and reality, and it gives us some stress. And so one of the ways to really importantly work on acceptance is by managing our expectations. For now, our expectations are different, and the more we can accept that, then the less of a sense of anxiety or anger or focusing on losses we will have. So those are kind of the two ideas that I've been thinking a lot about how we learned about these in brain injury recovery, and they apply to our situation now. One being the idea of the importance of structure, and the second being the importance of acceptance. So those are my 2 cents for now. I certainly wish everyone the best. And as Lester Holt says every night on the news, please take care of yourself and of each other. Thank you.